So as a dietitian, we're looking at how long have they not eaten, and how many in 1 month and 3 months and 6 months and a year. And so we're documenting those. And those are all parts of accounting for what is a diagnostic criteria for malnutrition, for example, not always just subcutaneous fat loss or muscle loss. Or always labs. So that's important to look at, is that gastroparesis will cause individuals to eat less and less and less. I tell clients all the time, I'm like, it reminds me of Alanis Morissette. Isn't it ironic? That is the song I always think about. Hello, welcome to the RD Roadmap, Journey to Eating Disorder Expertise. This is episode 7, Navigating the Rocky Path of Medical Complications. My name is Jill Sakey, registered dietitian.
My name is Mateos, registered dietitian.
Welcome back. And we are so excited to start talking to you a little bit about medical complications of eating disorders. And we know this is going to be a lot of information, and more than likely, this is going to be a 2-part series. So yeah, let's kind of dig into it. I wanted to first talk about the various complications we're probably going to talk about on the back end, and then just chat about, what we see in sessions and the things that oftentimes you don't get to read in books, right? They don't really talk about the interactions and observations that you see in session with clients. So I thought we could spend some time reviewing that. But we are going to talk about gastroparesis, SMA, intolerance to foods, lactose intolerance, laxative and diuretic use, how the brain's impacted, hormone disruption, including thyroid, when you have dizziness and fainting, all of those things, kind of a little bit more. We've talked briefly about it, but like the nutrition focused physical exam, things you physically see with individuals, different labs that you see that are abnormal, all those things will be talked about in more depth. So just be prepared. But we're going to focus on the first 3 or 4 things or so on the back end. But yeah, Mateus, like, what's it been like for you as a newer clinician in the field, navigating the medical complications? I know we always like to use analysis, but I always think about climbing mountains and like how difficult that is. I've never really climbed a mountain, but the last couple of weeks ago, my sister was in town and we went hiking, and it was a really rocky pathway down, and they said it was moderate with hiking. And we went down this. My sister at the end, she said, I'm climbing a mountain. That's what it felt like to her, like straight up. And she took a picture of she and I, like the depth of it. And then, kind of the back, within the back, it never shows the true elevation and shifts in a picture, but it was kind of scary getting up, and I've got my dog trying to get up at the same time, but it was navigating it. To me, that's a little bit what medical complications are like. There's a lot of navigating with, hey, as dietitians, we particularly know quite a lot about medical issues and things like that, but I didn't learn any of it in medical school. I didn't learn any of it in dietitian school for sure. I've learned it from working with clients and being in the field as long as I have. But I was curious, since, we may have newer clinicians coming in and listening to this, what was it like for you navigating that? Because I feel like you've had a lot of experience already as a dietitian in Brazil. Your training is so different than dietitians in the States.
Yeah, I think for me, it was very confusing because I would hear a lot of complications that I've heard before, but never in the context of malnutrition being the cause. Things like gastroparesis. I've dealt with the treatment of gastroparesis that were not caused by malnutrition. So decreasing fiber content in the diet and things like that were things I was already familiar with. But I think what was confusing is the amount of medical complications that can show up, in that first session. Some people come up with like a list of providers that they've seen. I've seen an allergist. I discovered I have this and this and this sensitivity. I see a GI doctor. I see a hematologist. I see a gynecologist, and it can be very overwhelming to hear all of that at first and be like, I don't know what to to address first, because it took me a while to see the congruence of like, well, it all kind of funnels down to malnutrition, so let's just go the same direction. So it helps simplify the path forward, I think. you
Yeah,
know?
it's almost like they unfortunately, with all the different providers they've seen, it's almost like you feel like you have to go on tangents and you have to dig into each one and what did the OB-GYN say and what did the allergist say and let's look at that report when we're not really looking at the big picture of someone's walking in severely malnourished with an eating disorder, may not even look malnourished, quote unquote, but you're feeling like you have to go on tangents. I know that's what I experienced a little bit when I was newer of like getting all the different reports and reading them and seeing all the different conflicting information that they're encouraging or suggesting, like going to a cardiologist and the cardiologist wants to put a pacemaker in for whatever reason, something odd like that, or put a heart halter monitor on for 24 hours because they have low um, heart rate or their sinus rhythm is off on their EKG, when it is probably more so the eating disorder piece of it. So this can be really challenging and it's easy to get pushed in a corner and trying to resolve one issue when in reality the big picture is resolving the malnutrition piece of it.
Yeah. And another piece that was overwhelming to me was the resistance that
Mm,
would come with treatment. Because whenever you start treating it, increasing food and all those things, a lot of the symptoms get worse. You know, things related to gastroparesis, for example, like it's gonna be uncomfortable. It's gonna be, so trying to hold space for the discomfort and validate that and have a level of firmness, with this is the way forward. Because I felt at first I felt so inclined to be like, okay, so we can reduce the amount of food a little bit. We can,
mhm,
we
mhm.
can, and in a way end up accommodating the eating disorder. And the next time it's like, oh yeah, it's still so much worse. And before you know it, you are accommodating the problem in a way,
Yeah, you're feeding into their fears because when you like the resistance piece of it, when you start to kind of go, well, I wonder if it could be this, like I'm noticing your intake is not adequate, or you're eating 10 cups of vegetables at dinner every night and you have inadequate protein and you don't have any carbohydrate and you eat Quest bars for every snack, whatever it might be. And you're like, it could be that you don't have enough carbohydrate on board. And then all of a sudden, like, oh, no way that can be it. And then you're now dealing with the eating disorder, right? On a very malnourished brain. So, by all means, yes, you get a lot of resistance when you go that direction. A couple of things that have helped me to navigate that a little bit. And I would be curious to see what you found in your practice now that you've been in it for a little while longer, is using the biology and the physiology as a form of validation. So I know there's a lot of, a lot of dietitians like to have great worksheets and visuals to describe things, et cetera. But when individuals are struggling with various issues, I like to use that as a form of validation of like, that makes a lot of sense that you're having some GI distress. The Quest bars have a lot of sugar alcohols in them. And also you're eating a large amount of fiber and you're also not getting enough energy in and that slows down things, right? And kind of getting them to kind of see that picture in a way that you're not trying to work around the fear but helping them be willing to approach their fear a little bit more, in a form of like I could actually see some relief from what I'm struggling with if I do happen to eat a little bit more. So I know it's easier said than done, but I think that's something that I do a lot, is using education about the body once I kind of grasp that it's malnutrition and try to use that as a form of validation to their experience. Because it's true. They probably definitely have severe IBS and constipation and diarrhea and all those types of things. What have you found that's been helpful for you? You're such a great educator with medical stuff. So I always love to hear you talk about medical things because you just have a great wording for it.
Yeah, definitely explaining the biology and using that as a way to validate, the experience is something that is very helpful. And I'd also like to talk about kindness,
Mm,
because I think that we need to first accept that gastroparesis is real, because I think that the clients can get really frustrated if you don't spend time agreeing and recognizing that they're going through, discomfort, not only from the mental side, because it can be very easy to be like, yeah, that's an eating disorder, and we need to keep doing it,
It's almost dismissive when you say, oh, well, that's your eating disorder. I get really frustrated when clinicians
Exactly.
do that. I'm like, that's a little dismissive. It's
Yeah.
true, but it's
So
dismissive.
exactly. So I like to explain, like right now, eating more, decreasing the vegetables, and increasing the carbs is something that's going to help the gastroparesis. It's going to help, that rebuilding a little bit. And it's an act of kindness towards yourself, because by eating all the extra fiber, all the extra vegetables, it's making it a more painful process for you. It's exacerbating the things that you are struggling with, and I know they can be scary to
Mhm.
let go of some of those things, like vegetables, that it's been something that you've been holding on so tightly for such a long time, And I also like to reassure that vegetables will have a space. They will be able to come back, because even the distortions of the eating disorder and all those things, I think that it's not black and white. There are aspects of like wanting to eat more fruits and vegetables that is not something pervasive, So there is room for those things to come back a little bit, and be part of a more wholesome, a more complete picture, I guess.
Oh yeah, I'll use that a lot. I'm like, hey, I'm a dietitian here. I'm all about getting you to live a long life and healthy life by all means. So I kind of validate that piece of it. Like I'm not interested in making you unhealthy. I'll even use their terms. I know that can be a divisive word, unhealthy or healthy type of thing, but you got to speak their language. You got to meet them where they are. And you're not agreeing with them. You're just helping them relate to what you're saying so that you can get them on board to hopefully what you're saying a little bit and y'all can move forward on that pathway instead of one running the opposite direction and you're trying to grab them and pull them up the mountain, right? That makes it even more difficult. So yeah,
Yeah,
so kindness, compassion, which I think what happens and with these physicians that they have 10 minutes with them and they just, you know, there's a lot of invalidation, unfortunately, that happens, and they leave feeling helpless and hopeless. We got some, and everything, well, everything looks normal, and then they just give them the blanket diagnosis of IBS, which I
yeah,
think is a true diagnosis for sure, but it doesn't really kind of show the essence of what they're experiencing and probably the malnutrition piece of it. Well, let's dig
yeah,
into it. Let's start with gastroparesis first. So join us on the back end so we can talk more about that. And we're going to go in depth with what to look at, why it happens, a little bit of those complications. And we'll have a ton of like resources on our show notes too. We're not going to be the holder of all the information out there. There's a great resources and education that will be on our show notes as well that you can access. So I hope you join us in the back end. See you
yeah.
in a few.